Hello all, I hope you're doing well. Today I would like to talk to you about a few types of therapies that involve the use of the eyes, as I promised in one of recent videos. And these therapies are EMDR, Brainspotting, and DBR, or Deep Brain Reorienting. I will be reading a bit as usual, not to miss some of the information that I want to share with you today. And I will also provide additional resource links in the description section below this video if you would like to get more information about each of those types of therapies. The first therapy, EMDR, also known as eye movement desensitization reprocessing, was developed by Dr. psychologist Frances Shapiro. She was noticing that eye movements, especially the ones that occur side to side as during REM or rapid eye movement sleep, could reduce intensity of thoughts, associated feelings, and she decided to try and develop this method, and actually it's been around for a while now. It's a psychotherapy technique now employed when people would like to process difficult emotional and mostly emotional issues related to trauma and other distressing experiences. So the way it works is that when you are seeing a therapist, they're employing this technique with you, they'll have you focus on the memory while you would be following a moving object, most commonly the ball on the screen, and it would go back and forth, and you could tap on your body in certain places as well, instead of looking at the ball, but most commonly it's a moving object and you're using your eyesight for that. So while you're doing it, you're picking a memory and you're guided through the process. I'm not a psychotherapist, so I just talk to you in general about this. And this type of technique usually works best for people who would like to reduce panic attacks. It could help with certain kinds of eating disorders and addictions and anxiety type of producing reactions. I did it myself, and I found that it does reduce the emotional charge of certain memories. I'm not sure if it always works for trauma, notably complex or childhood trauma that is more chronic in nature, but for somebody who had like a car accident related type of trauma or some single event other than that, it definitely could be quite helpful. And the contraindications with this type of technique might include things like schizophrenia or active delusions or hallucinations. These types of issues might make it difficult for you to be helped with EMDR. So, Brainspotting. Brainspotting is a psychotherapy technique that also uses eye movements to help people process and heal from emotional trauma and other psychological issues. It was developed by Dr. David Grant, and in 2003 he was working with EMDR technique and discovered that when a person was focusing on the issue, they would move their eyes to a certain position and would stay in that position while processing that memory. So it basically evolved into something that could also incorporate body sensations as well as EMDR, and specific eye positions are utilized instead of you having to watch a moving object with your eyes, such as what occurs in REM. In Brainspotting, like I've mentioned already, you focus on one spot while processing a memory, and you also become aware of your body sensations. So that part of it is actually from somatic experiencing. And while people are doing Brainspotting, what sometimes can happen is that they might get like facial tics or eye twitching or pupil dilation or constriction, swallowing, yawning. So autonomic nervous system kinds of autonomic nervous system related signs and symptoms. Coughing, furrowing, yawning, like I said, swallowing, moving the body might sometimes occur. This particular type of technique, it would enable you to access deeper emotional areas of the brain, bypassing the conscious mind. And sometimes it could be quite intense if you are accessing something like childhood trauma-related memories. So it is advised to, if you choose to try this kind of technique, it is advisable to find a therapist that is also very versed in attachment issues and childhood traumas and things like that. And last but not least, deep brain reorienting. This one is more recent, although it's also been around. And it was developed by Dr. Frank Corrigan to treat attachment shock. But also it can be used in some other cases where you want to process some unresolved traumatic experiences. It is now very much recommended for treatment of CPTSD and childhood-related attachment traumas and so on and so forth. With this technique, you basically turn your attention to target and track body responses in a particular sequence. And they start you with the grounding process to help you focus on where self, the part of the brain that orients to external stimuli. It does access deeper brain structures that are part of the visual system. And this has been found quite effective to help with initial shock that occurs as a result of healthy attachment not developing, for example, because once you are born, you're basically on your own. Your body will go, and the brain will go into a mode of do or die, so to speak, and to survive. Once you realize you're no longer inside the womb and your needs are taken care of, what happens in the brain, they discover now, is that this initial shock reaction that's kind of tends to stay there and imprint on your brain, so to speak. And then, of course, the autonomic nervous system responds to that, and it tends to create all sorts of processes, sort of like what Sarah Payton calls alarmed aloneness, where underneath the surface, so to speak, you're very much high-strung, but you could be perceived as disassociated and not fully committed to life on the outside. So again, I want to remind you that I will put additional resource links in the description section below this video. I hope you will find this material interesting or helpful. And as always, I am open to your comments, questions, and concerns. Thank you.